Hello, it's my usual 12 o'clock slot today, and today advertised slightly late. We're just going to talk about post-COVID dentistry and how dentistry is going to change going forward uh, um, when we eventually get back. I'm just going to wait for a few people to turn up, and we're going to kick off just at 12 o'clock. So just hang in there. So I know where all of you guys are from, but we'll just wait for a few more to turn up and we'll begin. Just a couple of minutes. So it's 12 o'clock. I hope everyone's getting some time off and enjoying being at home. Hopefully, to my followers on Instagram and Facebook, where we're streaming this live to both sites, you're getting some time for yourself and your families, and it's not been too stressful with practice life. I have to say, this morning we've had probably the most, or nearly the most number of calls for patients in pain and wanting advice and lost fillings. So it's been an interesting morning. So I wanted to talk just for a few minutes, and I mean really just a few minutes, about uh, how dentistry is going to change post COVID, and what the view is of many on online, and what the speculation is about how dental practice may well change. We may have all seen on Facebook and Insta the images of these nurses and doctors, clinicians at the front line and away from the front line but still treating patients, who are wearing these FFP3 masks, and what it does to their face in terms of bruising. And I was just reflecting on and thinking about how straightforward our dental practice lives are in terms of cross infection. You know, we're really good. I'm looking at the number of deaths, the tragic losses that have occurred in care homes, and I think, why is this? Why are there so many passing away in care homes? Yes, that they're obviously ill anyway. They're elderly, they're frail, they've got comorbidities, polypharmacy. There's lots going on, and so they are very susceptible. But that still doesn't reflect. The numbers that are passing away compared to general population and in hospital. And I come back to the fact that it's possibly because cross-infection control isn't taught to care home professionals as it is to medical and dental professionals, and particularly dental professionals. We are very good at cross-infection control, and I think that's shown by the fact that the very low numbers of incidents of a disease generally. You know, it's very rare that there'll be a case of a serious infection in a dental practice, and that's because our dental nurses and our dentists, you know, they are trained very well, and we are pushed and made to do continuing professional development in this area. And of course, it's something we would want to be good at and make sure of. So separate decontamination room in most practices, following as much to best practice as possible, and certainly when you're putting in a new practice, you know, airflow, ventilation. Within HTMO 105, there's a lot of standards you have to hit. So I think we are good at cross-infection control, but I think post-COVID, this area is going to come under a lot of scrutiny, and I don't blame patients for wanting to learn more about how we do cross-infection and what the role of the dental nurse is. So I think having that information front and centre will really allay patients' fears for how we're looking after them and how we're continuing to care. So I'm reading lots of guidance from the US on what they're saying about what's happening after COVID finally moves away from us, and we're out of the difficult period we're in at the moment. And what I'm learning is that lots of dentists in the States don't really work to evidence-based practice. Now, maybe I do, and therefore I assume everyone else does, but I think the vast majority of certainly dentists that are online and somewhat tech savvy are learning and watching the webinars and going to professional development courses, and we are careful about our cross-infection. But I guess there will be a certain number amongst us that work, that are just bashing it out, are just running that conveyor belt as fast as they can to get patients through and maximising profit. But I was quite struck by the number of articles I've read from the US that are saying now is a time to look at evidence-based dentistry, now is a time to look at making sure your policies and procedures are in place and up to standard, and that your lead infection control coordinator is doing what they're supposed to be doing. And I'm thinking, well, in the UK, I'd like to think that we're much better than that, and we are already doing that, because we do have, cross-infection is drummed into us from day dot, and I think it's, if we're going to compromise on anything, it's not going to be that. So I was a bit struck by what I'm reading from the US, and I'd like to think, as I say, that the UK is much better in their delivery of and their protection of patients in terms of cross-infection control. So I hope that the practices that that when we closed, the public will look upon us as doing that as an act of protection for the public. Nobody's ever going to say that poor dentist, but you would hope that our image after this will be better. Although I believe that dentistry is still not seen as mainstream, as it were, until a patient's got a problem. So I'm hopeful that as we move forward into the post-COVID world, that there will be some common sense, and that cross-infection will be at the forefront of all of our minds. There will be a tendency when we get back to really push forward and try and recoup losses, and I think this is a time when we need to just slow down, really slow down, and focus on protecting our staff, ourselves, our patients, and not rushing to recoup losses that we've incurred. And it will be really difficult not to try and rush to deliver treatment plans and to close sales, as it were. It will be very difficult, but we've got to take a measured approach and a very slowed down. I was going to say relaxed, but it's not going to be relaxed for us. But I think as far as the patient's concerned, we don't want to be rushing them back into big treatment plans. Certainly, if we're also having to deal with a new methodology for cross-infection and personal protective equipment, if we're working in FFP3 masks, I think that's going to take a little time for us to get used to, and I wouldn't want to be rushing into major treatment plans anytime soon. I think there's going to be a stabilisation phase for patients. There's going to be certainly some work that needs doing. It's whether or not patients will feel comfortable, depending on the economic climate, as to whether they're going to allow us to do treatments to the nth degree. I think we're going to have to look at staging a lot of treatments and making sure that we're sympathetic to the financial constraints our patients are going to be under. Before we get to patients, I think there's going to be an understanding that within our teams we're going to have to look at the environment and understand our airflow, windows, flooring, and in those areas where we've got away with not having capped and coved surgery flooring and not really going to the nth degree, I think we've got the time now to push ahead and try and make our practices as cross-infection friendly to the highest degree HTMO 105. Although there are many flaws with that policy, that document, it does give you a good understanding of where we need to be for ultimate patient protection. but the main thing is how we behave with our patients. You know, are we opening a drawer with a gloved hand? Are we not using the plastic sheathing that goes over the light handle? It's all those things that we may have seen as a chore are now going to have to be at the forefront of our minds, because today it's COVID and tomorrow it'll be something else, and we don't know what that is, and we have to have universal precautions and protect everyone and protect ourselves and our staff and our patients. So I think looking at our environment in these days, you know, you may have just bought a practice, you may be in a practice for 20 or 30 years and everything in between, but I think we've got an opportunity now to really focus on our learning and grow and develop and understand whatever topics we want to, but particularly things like this. But certainly we need to go into our practices, have a wander around and see where we can improve things. Yesterday I talked about behaving as if you are a big organisation, and if you're a big organisation, would you be accepting of old magazines in the waiting room, or would you be accepting of the carpet coming up and not being put down, or an area that's difficult to clean in the waiting room? I think we need to be forensic in our analysis of our practices, and where possible, and I appreciate money is probably tight, and looking at renovating or tidying up your practice is not at the forefront, but I don't think these things are particularly expensive. They just need some joined up thinking and maybe your staff to help you to look at what can be improved in the practice that will make looking after the practice and being more compliant and being more safe much easier. So I don't think it's a cost thing. I think it's a time thing, and we have time. So utilize this time. I'm happy to talk to anyone if I can help anyone. As I've always said, my text number is on somewhere. Just drop me a message or message me on the forums. But certainly, I think with the gift of time that we have, we should really look at going back into our practices and working out what we can do to make it much easier to look after. So in your decontamination room, if there's no zoning, then think about your zoning. If there's no sink outside your practice or for hand washing, if it can be incorporated, then do so. We were in the process at the beginning of the year of looking at our cross-infection in one of our practices, where we're in quite a tight space, and we were looking if we could take out a wall and make it just that little bit wider, and maybe that's what we're going to have to do. So there will be some cost involved, but I'm hopeful we'll get it right, and we'll get it to a standard where our patients, when asking about our cross-infection, will be very impressed with what we're doing. And I think as long as we can reassure patients, so we look after patients now in their time of need, we give them the advice, we're always available, we're calling our patients to make sure that they're okay, both dentally and in general. Some of our patients are very elderly and could do with the help. And do you know what? Just having our phone number, having my number for my patients, is not only the reassurance they need, it's their families will also be happier if they're living distantly, knowing that, you know, the dentist is called and he's left their number. That can only be a good thing. So if you're watching this now, or if you're watching this on a replay, please pop comments in the bottom. Tell me where you're coming from, what practice you're working in, and where your interests lie in terms of what you'd like me to discuss in future Facebook and Instagram lives. So I think when we get back to dentistry, it will be different. It will be different, unless the government waters it down to say, instead of FFP3 masks, you can get away with the standard surgical mask, because the supply is still a problem. Because even though we may have moved out of our COVID period and our peak period, other countries, other larger, more populated, less affluent countries will be going through the same. And as it reaches through Africa and Asia again, in places like India and Pakistan, where the population is massive and the density of population is huge, there will be an increased demand for PPE across the world. So I don't think that just when we come out of this that everything will be available as quickly as we'd like it to be. Having said that, if the government is setting a standard that's very high, I personally think for the short term, for 6 months after we get back, that we should try and work with FFP3 masks if that's possible, and really go to town on the cross-infection, and then see how things open up, how things change, and see what the Department of Health comes out with. So I am hopeful that we'll be back towards the end of June, but and that's what I'm planning on. But we just don't know. I think all that we can do is control the controllable, control what we know, work towards the best practice, the most safest way of delivering care for our patients, and leave the rest to whatever, because we can only do what we can do. There's no point getting worried or upset, but I think using this time to ensure that your practice is of a certain standard, and that doesn't mean that just the dentist wears the FFP3 mask. If you're going to do it, you've got to do it for your whole team, and this is where the expense comes in. But I think in the long term, either UDA dentistry will have to be rethought. I don't know what's happening in the pilot practices. I'll be interested to know if anyone's got any comments about the pilot practices and how they're affected, if they're affected any differently. And I think it's good just to read around dentistry around the world and see what's happening. The talk outside coming out of Wuhan is that they wished that they had been much harder on primary medical practices and dental practices to ensure that cross-infection was of a much higher standard and best practice was disseminated much more quickly. Now, I don't know what standard dentistry was in China anyway, and maybe their standard was way below what we expect in the West. But still, I think we do need to reevaluate our existing practices and make sure that we're delivering care again in a safe and compliant manner. But sometimes if the government does water it down, I think we've got to understand that we are professionals and we are clinicians, and it's very important that it's our responsibility for our patients, regardless of the directives that are coming. And if we feel those directives are watered down for expediency, then it's up to us to be professional without putting ourselves first and thinking of our patients and our staff, and to set standards that may be higher than what they're asking for, if that is what we feel is necessary. These are just my thoughts on a post-COVID world. I think we have to just make sure that we don't jump into doing dentistry too fast, slow things down, and be mindful of our patients and their expectations and their worries. And I think this will take time to discuss and talk. So that there must be a team approach, because the dentist can't do it all, to really discuss with your patients and allay their fears. And that starts from the phone call to book the appointment to when they come in to speak to us. And we're working with our teams to make sure that we understand that we're going to deliver care in a maybe a subtly or slightly different way, and hopefully to the betterment of our practice long term. I wish everyone best of luck with their endeavours in navigating this period, and of course I'm always available to help whoever needs anything. Take care, and no doubt I'll speak to you tomorrow. Topic to be announced as early as I can get it. Take care. Bye bye.